Prince Charles Hospital in Merthyr Tydfil, South Wales, is a leading specialist hospital in the area of diagnosis, treatment and follow-up of colorectal disease. Professor Haray and Mr. Masood, together with Mr. Joseph and all their staff, hope that this DVD will provide some answers and reassurance during this difficult time.
You've been given this DVD by one of the members of staff from the colorectal department because you've either been diagnosed with bowel cancer or are strongly suspected to have bowel cancer. This can be a very difficult time, not just for patients but their families as well. And it's because of that that we have taken the trouble to design this DVD specifically to help you through the process of understanding the various tests and the treatments that you might have to undergo. The majority of colorectal cancer can be cured if it's caught early. And even for those patients who have advanced disease, there are still lots of treatment options available. This DVD will show you lots of different diagnostic tests as well as treatments. And I must emphasize that not every patient will necessarily have to go through each of these tests. I hope you find this DVD useful as you go through the process.
When you arrive at the Prince Charles Hospital, your first visit may be to the Rapid Access Clinic, where the dedicated colorectal team will ensure you receive a range of tests to help diagnose your condition.
Many patients with bowel problems are referred to bowel surgery services. We assess these patients in a rapid access one-stop clinic. These patients have detailed examination of the abdomen and their back passage. Some of these patients may be referred for examination of lower part of the large bowel. We have facility to perform this examination on the same visit.
Following your referral from your GP, your visit to the Rapid Access Clinic and your clinical assessment, a series of tests will have been decided upon to diagnose your condition. You will then visit either the radiology or endoscopy department, or in some cases both.
I'm Jill, I'm the endoscopy unit manager. This is the department you will come into for your test.
My name is Anton Joseph, I'm one of the surgeons here. The test I normally do here is called flexible sigmoidoscopy or colonoscopy. It's a test mainly done for problems with the rectum or colon.
This is the instrument which we use to examine the colon.
Mr. Joseph has just started. As you can see on the screen, it's a very clear picture can be obtained of the inside of the bowel. All the pink stuff that you see is the lining of the bowel, and obviously there is sometimes a bit of stool residue. So we're nearly finished now, and everything looks wonderful. Nothing to be concerned about there, okay?
Radiology comprises 4 tests: CT, MRI, barium enema and ultrasound.
Medical imaging plays a central role in the diagnosis and treatment of bowel cancer.
Hi Matthew, I'm Richard and we're going to be carrying out your CT scan this afternoon. What we're going to do is see you've got a needle already in your arm. When you go through the hole, the machine's going to ask you to hold your breath a few times, and as the dye goes around the system you might get a bit of a warm feeling. Nothing's going to touch you, nothing's going to hurt you, nothing unpleasant about the examination at all, okay? About 20 seconds the whole examination is finished.
Although CT is of some use in looking at the tumour mass itself, it's best, particularly for lower down in the rectum, to use a technique known as magnetic resonance imaging.
I need you to keep still, and we're going to move you into the middle of quite a big machine that makes a lot of noise, and nothing will touch you and you don't feel anything.
Following the tests you have had in either endoscopy and or radiology, a weekly meeting of all consultants, specialists, nurses and staff is held to decide upon the correct course of treatment for your condition. This is known as the MDM, or multidisciplinary meeting.
Good morning everybody. Let's start off with I think the first patient is yours, Ash, is it?
Fresh rectum bleeding. He's had no change in bowel habits and no weight loss and no other alarming symptoms.
Found a malignant looking lesion in the upper rectum rectosigmoid junction, so I biopsied it and I organised some CT and barium to have a look at the rest of the colon.
It's a grade 2 infiltrating rectal adenocarcinoma.
Workup, because it's a rectal tumour, so we've got MR images as well. Now this is the nice sagittal image, shows the tumour in its long form, and you can see it's got this apple core appearance which we see usually on the barium. That's looking promising for you boys to get out. We've also done a barium enema on this patient. As far as the rest of the bowel is concerned, I don't see any evidence of any other lesion in any part of the bowel here.
Following the decisions made in the MDM, clinic is scheduled, usually the same day, to discuss the findings and course of treatment for each patient.
Hello Alan, how are you?
All right, thank you.
Good. My name is Masood. I'm one of the consultant surgeons here. This is Maria Lewis. our senior colorectal nurse specialist. Your tumor is here. It's near the bottom end, but it is high enough so we can join the bowel together after removing this tumor without excessive difficulty.
Right.
Do you feel that we've covered everything you need to ask us? Are there any questions?
No, that's quite fine. That's everything I wanted to know.
Depending on the treatment options, as discussed during the colorectal clinic, chemotherapy and/or radiotherapy may be required before any surgery is scheduled. Further information on preoperative chemotherapy and radiotherapy can be found in the extra section.
Good morning, Mr. Watkins. It's Dr. Mukherjee here, and this is Helen O'Neill, our oncology specialist. Number is quite low down, but it's also maybe stuck down a bit, and Professor Hare wasn't sure whether he can take it out confidently without leaving things behind. And we really don't want to get into that situation where things have been left behind. We would rather get the whole thing out. And one way of doing it is to try and shrink by, we're going to use a combination of treatment with chemotherapy and radiotherapy. The radiotherapy is principally done at Velindre Hospital back in Cardiff. The chemotherapy are in the form of tablets.
Any questions you may have regarding your hospital stay, surgery and recovery are covered by the ward staff.
Hi, I'm Nigel. I'm a charge nurse here on Ward 1. We're a surgical ward and we will be catering for your needs during your stay here on surgery.
Following a night of no food, the hospital staff take you to the operating theatre reception in preparation for your surgery.
Good morning, I'm Cheryl Walden, I'm senior nurse for the department.
For some of you who have never been to theatres before, we are the anaesthetic team. We look after you during the operation and we also look after you after the operation.
What we're about to do today is quite a major surgical procedure, cutting out rectal cancer in a patient who's had preoperative radiotherapy and chemotherapy. Do this kind of major procedure, whether you do it by keyhole surgery, as we're going to attempt in this case, or whether you do it by open surgery, you need a lot of specialist support from various members of staff.
After surgery, the ward staff provide round-the-clock care and ensure that you mobilise as soon as possible. Follow-up is scheduled for each patient depending on their specific requirement.
Following surgery, each patient will have a 6-week follow-up in the surgical outpatients department to make sure that they've fully recovered from the surgery. If they then need to go on to have adjuvant chemotherapy, they would have had an appointment with our oncologist and a regime would have been started for that oncology period. They will stay with the oncologist until treatment is finished and then they're handed back to the nurse-led cancer follow-up clinic at Prince Charles Hospital.
As a group of professionals dealing with this condition on a regular basis, we are all very aware that this can be a very worrying and difficult time for patients and their families. This film has been made possible with the help of many of the staff here at Prince Charles Hospital. I hope that it gives you an insight into what to expect during the process of having the diagnosis and treatment for bowel cancer. If you're not clear about anything at any stage, please feel free to ask one of the colorectal team.